الرحمن بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. The opening. In the name of God, the most compassionate, the most merciful. Praise be to God, Lord of all the worlds, the most compassionate, the most merciful, Master of the day of judgment. It is you we worship. It is you we ask for help. Guide us to the straight path, the path of those on whom you have bestowed your grace, not those who are the objects of anger, nor those who go astray. So once again, welcome everyone. I'm going to begin with a land acknowledgement. I'd like to acknowledge the traditional territories of the peoples of Turtle Island, the sacred land on which we are gathered today, where I am actually, has been the site of human activity for 15,000 years. We acknowledge the land we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto, or Takaronto, is covered by Treaty 13 with the Mississaugas of the Credit. Today, the meeting place of Toronto is still the home to many Indigenous peoples from across Turtle Island. As Canadian Muslim women, we recognize the connection between anti-Indigenous racism and Islamophobia, and we're committed to working toward justice for Indigenous women and girls in Canada. So just before I hand over the session to Sarah, I'd like to tell you a little bit about why we're doing this work and why we asked Sarah to conduct this very important research. It was really important for CCMW to hear from women that we seldom hear from. We've done many studies on their demographic studies, socioeconomic studies, but we always found that we weren't reaching all of the women that we needed to reach. So this was an attempt to reach women that we seldom hear from. And also what I found about the whole experience was that it has been very humbling. It's been extremely humbling to recognize our own privileges in the work that we do, and reflect on Sarah's findings and hear the voices that we seldom hear, and then expand on issues that we're going to actually be expanding on today, that we get very little chance to actually do it. So hopefully we're going to open up the discussion. We're going to hear from a very diverse group of women themselves, with diverse backgrounds and intersectional identities. And inshallah, we'll be sharing a lot of learning. Before we begin, I'd like to just go over some ground rules. So I'd like to acknowledge multiple viewpoints and opinions, because we will have many different viewpoints and opinions throughout the session. And let's own our intentions and the impact of what we're sharing and saying, and reflect critically and respect everyone's viewpoints. Recognize our own privileges and honor the different experiences we're bringing into this space. And let's challenge and discuss with care and empathy. For me, care and empathy are fundamental to the work that we're doing. And let's take care of each other while we're doing this, and be empathetic. And then we invite questions, comments, discussion through the chat box. We will be having a Q&A, and feel free to unmute yourself and turn on your camera if you wish. We will be recording the session, if you don't want to be captured in the recording, you could always use the chat box for your comments and exchange. So we really invite dialogue from you, because this is, after all, a community dialogue. So now I'd like to introduce you to our amazing Sarah Shaw. Sarah Shaw has a PhD and is an assistant professor at the Department of Sociology at the University of Toronto, Mississauga. a research fellow at the Institute of Islamic Studies at the University of Toronto, and a research consultant for Canadian Muslim organizations such as CCMW. They're a lead researcher at the Muslims in Canada Data Initiative, and their research focuses on the intersections of religion, family, and gender relations. Racialization and immigration and mental health are her areas of expertise. Over to you, Sarah.
Thank you so much, Nozat, and thank you everyone for joining in today's event. This panel discussion follows the reports, Voices That Matter, which you can access on the CCMW website. I am joined today by esteemed panelists who will speak to specific areas from the report. Those of you who read the report or attended the launch will recall that there are particular findings related to mothers' experiences specifically. And so today we're going to focus on the experience of mothers. Our conversations will highlight the experiences of mothers at diverse intersections, including at the intersection of immigration and citizenship, race, the economy, and the public sector, including healthcare, education, and social services. Before getting into the experiences of Canadian Muslim mothers more specifically, I'd like to provide a bit of theoretical understanding using social theory so that we can better understand and contextualize the experiences that we're looking at. So to understand the experiences of Canadian Muslim mothers, we need to understand how different social systems connect us in these interdependent processes, these interdependent ways that also create hierarchies and differences. What this means is that we need to understand gender, race, immigration, and the economy, and all of these social institutions being organized in a very specific way that connect all mothers while also creating hierarchies within mothers. This hierarchy of mothers becomes apparent when we look at the experiences of racialized and especially Indigenous mothers in the Canadian context. White, Christian, middle-class mothers are typically socially constructed as good mothers, and other mothers who fail to be white or Christian or financially secure are automatically framed as being bad mothers, regardless of how they actually mother. This also intersects with Canada's immigration policy, historically, of accepting certain kinds of immigrants that were framed as being desirable. And I say historically, but I just read this morning about how Canada will be accepting an unlimited number of certain kinds of refugees. So apparently there's still a good kind of refugee in this country. Now, I don't mean to be flippant, it's a very complex situation. But it is important to note how global patterns of migration and who is considered to be a refugee worth helping impacts mothers as well. For marginalized mothers, denying their motherhood sustains the social systems of oppression. So, for example, if we think about economically marginalized women, and if we think about how the Industrial Revolution pulled workers away from the farms and away from their homes and into factories, there were new mothers who would have just given birth, and the factory owners would expect them to come back to work the next day. These women's motherhood was denied. Instead, they were seen as basically cheap, replaceable labor. They were just seen as workers. So, not surprisingly, there was a concern about the infant mortality rate as these young babies were left without care. This is what brought about maternity leave. It wasn't something for the mother. It wasn't like you just gave birth, your body needs to recover, you need to spend some time with your baby. It was more of, you don't know how to be a good mother, and so we're going to pass this law to force you to stay at home because you don't know better. So it was very patronizing. Nonetheless, it was a protection for the children. And we notice, if you compare the English context that I just mentioned to the Canadian context, we see similar kinds of protections for children who are white, but not who are racial minorities. In fact, instead of forcing racialized mothers to be with their kids, there's an opposite there's a pulling mothers away from their children. I have on this slide The Scream by Kent Monkman, which depicts a scene of the RCMP officers ripping children away from Indigenous mothers. And this is a scene depicting the 60 scoop. And this relates to the experiences of Black mothers in the North American context historically and even today. During the slave era, babies were taken away from Black mothers as if they were chattel. And still today, researchers continue to document how Black women's employers deny their motherhood, focusing instead on how they can be further exploited as cheap workers, as labor. Now, taking that and adding in the layer of immigration, immigrants are accepted into countries for two prime reasons. One is to increase the population, and the other is to provide a supply of cheap labor. So good immigrants, or immigrants that are framed as being good or desirable, those are the ones that are expected to reproduce and to increase the population. And other immigrants are expected to provide cheap work. And you'll never hear an official say this out loud, but you pick up on it through things that they say in more roundabout ways. So for example, in industrialized countries like similar to Canada, the UK, or France, you'll hear that the public has concerns about how many children that immigrant mothers are having, and that it's shifting the number of the citizens of a certain race or religion. Now, the irony is that these countries actually really need those children to be born. In order to have a society that continues to function, you need to have a sizable population that is born. And to create that population, you have to have a birth rate of like 2.1. Canada's fertility rate is actually 1.6, is below replacement level. So Canada actually needs the kids, and yet at the same time, there is this like anti-mother atmosphere that makes it difficult for immigrant women to sustain employment or to continue employment while being mothers. There's a framing of immigrant women as being seen as cheap workers. And even with this project, although it was situated with an intersectional framework, there is a bit of discomfort that I felt with the focus on Canadian Muslim women's labor force participation, because it does feel like an extension of this like neoliberal colonial project to exploit immigrant women. And if you're interested in that line of scholarly work, I do recommend the book Birthing the Nation by Kanane. There's a lot more to say on this, but in the interest of time, I'm going to continue forwards. Now, I started off talking about how there's a hierarchy of mothers and how this hierarchy creates different but interconnected experiences for mothers. While mothers of white children were pushed to be at home with their kids, mothers of racialized children would have to fight for their right to be a mother. And so we see differences in women's approach to understanding motherhood in relation to patriarchy and in relation to feminism. The system that privileges the birthing of white children expects white women to mother and not work for pay, while it expects the opposite of other mothers. For example, there's a phenomena of transnational migrant mothers. These women typically immigrate from sending countries like the Philippines, where they leave their families behind. They leave their children behind in the care of relatives and of other women. And they come to countries like Canada, where they can take on care work and do the mothering work of other women, typically privileged white women who are able to pay for this kind of service. For the white mother, this is a pretty sweet setup. She gets to work like a man. She doesn't have to worry about taking care of her kids. She can come home and be with them at the end of the day. This is an opportunity for her to realize her full potential. She can pursue her career and she can fight for gender equity and equality. For the transnational mother and for her children, however, this is an incredibly painful situation. Perennias is a scholar who has done extensive research on the pain and the emotional realities of these transnational families. And she finds that these mothers have to negotiate and strategize to find ways to manage the emotional pain. Not all women are able to do this. Some transnational mothers refuse to take on care work, and they specifically only engage in domestic employment that involves cooking or cleaning or other like non-care related work. And they say it's because it's too painful to take care of someone else's kids when you know that your own children miss you. In addition to the differences around who gets to mother in this hierarchy of mothers, there's also other differences in the ways that women mother, and this depends on the children that they have. You'll notice that at times, instead of saying white mothers, I will specifically say mothers of white children because there is a difference. Mothers of white children do not need to advocate for them in the same way that mothers of, for example, Black children do. In Patricia Hill Collins' work, Black Feminist Thought, there's a chapter dedicated to Black women and motherhood. And in that, Collins writes about how even white mothers who have interracial children, for example, who are read by society as being Black, those white mothers will take on the kinds of institutional advocacy work that Black mothers do for their children as well. And I don't mean to say that mothers of white children can't engage in these kinds of maternal politics. On the contrary, Sarah Ruddick, who was my first boss actually at the tender age of 14, she argued that everyone, not just women, everyone has a capacity to mother. And if we did move through the world that way, we would engage with each other in a very different way. On the battlefield, for example, a soldier holding a gun to his opponent would look up and wouldn't see his enemy, but he would see the child of another person. This line of feminism doesn't get as much attention or airtime because maternal politics is more present in intersectional feminism rather than in liberal feminism. We see liberal and typically white feminists framing family and childcare as antithetical to women's liberation, and this is true for their experience as well. In the Canadian context, for example, after World War II, to avoid another economic catastrophe like the Great Depression after World War I, white women were expected to go home and to have children en masse, and hence why there is the baby boom. Part of this was to replace the population that was lost due to the war, and also the delayed births that were pushed back because of the war. People tend to not want to have children when it's a difficult time. But part of this was also in order to prevent competition on the job market between white men and white women. And so family and motherhood is used to block white women's opportunities. We see this clearly in employment discrimination targeted at mothers. Maternal employment discrimination is when women become mothers and they are read as having these extra responsibilities now that they are mothers, they experience a loss in job status, in pay, or opportunities for advancement. The Saskatchewan Human Rights Commission in Canada says that 1 in 10 workplace complaints is related to pregnancy. So that's 10% of all workplace complaints. This graph on the right shows how maternity discrimination largely explains the differences between men and women's the earnings disparity. And women experience further penalties for each additional child that they have. Men do not experience the same losses. And I should say that there's a diversity of experiences in maternal employment among women as well. So for example, by class, this chart on the left is taken from Sarah Damaski's book, For the Family. In that book, she challenges the conventional explanation for women's employment patterns. Typically, convention is that more privileged women, more privileged mothers would be able to have the option to stay at home if they so chose to, because they have the finances to, like they have the household resources to accommodate that, but that more marginalized mothers would have to continue to work for pay to bolster the household income. But in Damaski's research, she finds that it's actually more privileged women who continue to work, while more marginalized women end up leaving the labor market or at least having disruptions in their employment. She argues that class privilege is important here. While women with privileges have the resources to adjust to changes in their lives, like children being born, they are able to navigate these transitions and they're able to mobilize their resources. So for them, it makes sense to keep working. For women who are more marginalized, they can't navigate the transitions as easily. Having children is a serious disruption given the job conditions do not allow for flexibility. On top of that, the work is not typically what we would consider like good work. They're not getting the same kinds of intrinsic value or personal feelings of satisfaction from doing the work as would more privileged women. You need privilege to access good jobs. And likewise, you need privilege to access good healthcare. Now, we know that the more privilege you have, the more likely you will be able to access better healthcare, and so you'll be healthier. And it's not surprising then that researchers interested in studying social inequality will look at social determinants of health to see where there is inequality. Maternal health is a key outcome of interest to researchers. If we look at the United Nations calculation of the Gender Inequality Index, they use health, empowerment, and the labor market participation rates to understand how gendered inequality is within a nation. And if you notice, both of the measures for health are related to maternal health. The first measure is maternal mortality ratios, and the other measures the rate of teen mothers. Now, thinking back to the hierarchy of mothers and how race and colonialism structure that hierarchy, we can see further disparities in maternal mortality even within a nation. In the American context, for example, Black women are almost 4 times as likely to die giving birth compared to white women. This is systemic and in part due to different kinds of care that they experience. So recall from the Voices That Matter reports, the experiences of newcomer Canadian Muslim women, especially ones who didn't speak official languages, and how they were treated in the healthcare setting or in public settings. This extends to other kinds of social services too. Now that we have a bit of grounding in the social processes that are interconnected across these different social institutions, I'd like to bring the focus back to the Canadian Muslim context. So here I've provided a brief bird's eye view of Canadian Muslim households and families. 2 demographic characteristics specifically I want to focus on that create specific lived experiences include household resources and family size. Now, we know from the work of Abdul Mohammed Kazimpour that Canadian Muslims' socioeconomic outcomes are much poorer than other religious or racialized groups. And this isn't a matter of just immigration, as we know that second and latter generations of Canadian Muslims still experience poorer outcomes compared to others. And from the works of Maurici and her colleagues, we know that when Canadian Muslim immigrant men experience work-related discrimination, they react by becoming more controlling over their wives and their children. And we know from my research that when Canadian Muslims feel like they're being othered, they also tend to be the ones who report more gender rigid beliefs. So having fewer resources has tangible realities in terms of physical and fiscal consequences, but there are also consequences for the social ordering and the social nuances, the experiences of being gendered or gendering within the household. In addition to that, there is the size of the families. Canadian Muslim households tend to have larger families with more children. Often these families are multi-generations and living under one roof. The amount of care work that Canadian Muslim mothers do then will also increase proportionately, and it'll be that much more intense. The way that this type of family context may weigh unevenly on Canadian Muslim mothers, especially in terms of mental health, has not yet been explored. Now, these demographic factors collude to create unique experiences for Canadian Muslims. So, for example, Now, Shadim Hussain was talking about the UK, the British context, but I would argue that his line of reasoning holds for Canada, the Canadian context as well. Hussain found that because of the multi-generations living together in Muslim households, that Muslim families were particularly at risk for COVID. These households include young children living with elderly parents, elderly grandparents. Now, in the Canadian context, having fewer household resources mean that you will likely also have a smaller living space as well. So isolating when you have that many people in a small space may not be an option. And of course, we know who is often assumed to be the person responsible to do the care work when someone gets sick. COVID is just one example of how this would manifest in Canadian Muslim households. What I mean to stress here is that we need to understand the larger social processes and the ways that institutions intersect to better understand any social phenomena, especially that affecting Canadian Muslims and Canadian Muslim mothers. Now I would like to turn to our panel. We're first going to hear from Yusra Kadir, who will speak on the experiences of newcomers and refugee mothers. We will then hear from Arij Elmi, who will speak about Black Canadian Muslims and the racial hierarchies and legacies of the Atlantic slave trade. We will then hear from Arfa Dar, who will speak on Muslim mothers' career and employment advocacy. And then from Muna Saleh on mothers of children with with disabilities. And lastly, we'll hear from Natasha Akhtar, who will share about single mothers and accessing social services. So I'll go ahead and stop sharing my screen and invite Yusra to come speak.
Thank you so much, Sarah. Thank you everyone for attending. So as Sarah mentioned, I will talk about refugee and newcomer mothers. I work with an organization called the Mothers Matter Center. So we work very closely with immigrant and refugee mothers across the country. And as I was hearing Sarah speak and I was looking at the statistics and the review of other studies that she referred to, I realized that not only have inequities consistently been occurring over a long time, but it's also in some cases, I feel like some things have intensified. So instead of getting better, they're actually getting worse. So I'm going to start off by saying that we know that gender inequalities exist and they have been a long-standing issue, and women are likely to be more intensely impacted by various things that happen, and COVID is one of them. So in acknowledging that the system was broken even before COVID arrived, and then so the COVID crisis sort of gives us an opportunity to take stock and improve and mend whatever was not working. I'm going to talk about women and then mothers. So we know that women had an increased risk of gender-based violence, especially during the time that the pandemic was around, and it's still around. There was more economic stress. There was increased care work, and there was reduced access to support services. So all of that, when it comes together, the picture is very bleak. And then I want to talk about mothers, because there's additional responsibility and additional accountability when you're looking at the situation as a mother and you have children to take care of. And when you're a mother and you're a racialized woman and you're an immigrant or a newcomer and you don't have the language skills and you're navigating a new culture and you're dealing with, how my kids should perhaps keep following my religion, and you're learning where to do grocery from and learning how appliances and doors and things work, and also you don't know how to approach the school, you don't know how to approach the doctor, you don't know how to register for public benefits. So all these layers and barriers, they really add up. So through our work and through personal experience, you find that lower socioeconomic status and the more barriers you face, the need for services is most dire. So people who need the services most also often face the most barrier. And so there's this cycle that just continues, that needs are not met, and you're isolated, you're vulnerable, you're low income, and needs are still not met. So there's a chance we see in, when we intervene with mothers, and we know mothers would go out of their way and make choices that they would not perhaps make if they knew that it would impact their children differently, if they knew that it would mean a better chance at school or at a career or at life for their children. So to feel okay when mothers matter, and when mothers have the facilities and the services and the confidence and the capacity that they need, everything else seems to fall in place for the family, especially the children. And then maybe in going forward, we can have some structural changes and change systems around in a way that the upcoming generation, they have, they're not trapped in that circle. So I'm going to talk, I know all of us know the facts in terms of racialized women and newcomer and immigrant women. There's discrimination, there's racism, and I appreciate Sarah talked about the situation developing in the most recent migration and refugee situation that we have seen, that people of color, there are problems. If the refugees look different, or if they are from a different place, or if they're not low income, the attitude and even the policies, unfortunately, seem to be different. So the unemployment gap right now between racialized and non-racialized women in Canada, it's 92.1%. There were statistics put out by the government of Canada, actually, that the non-racialized women, the unemployment rates were around 9.3%. And for racialized women, they were around 20%, 18%. So I know the South Asian community, for example, it was 20.4%. For Arab communities, it was 20.3%. And so really, it's a lot, 92.1%, the unemployment gap, it's a lot. And we know that immigrant women, they are around 1/4 of the working female population in Canada. So 26.1% of the working population in Canada, females over 15 years of age, that's immigrant women. And when they lost employment, if we look at the figures of loss of employment across Canada, 40.5% of immigrant women reported that they had lost employment. So that's really, they're disproportionately represented in that figure. So 1 million people lost jobs in Canada during the pandemic. 63% of them were women. A lot of mothers lost their jobs, some because they were working in industries and there's discrimination and racism and they were the first ones to go, and some because they just had too much to do at home. You had children who were home, you had spouses that were home, there's unpaid care work, and you need to juggle a variety of things. And not everybody, as Sarah's statistics also said, not everybody has the luxury for childcare services, and not everybody has good housing situation which can accommodate everyone in the house, and not everybody has enough food to go around in the family. So I don't want to keep throwing figures at you, and I want to talk a little bit about a journey of a refugee or immigrant person or a mother who's coming to Canada. So people would leave their home, which they don't want to leave in the first place, and they would leave because they want a better life for their children. They would go through perhaps years of displacement through refugee camps, or make precarious journeys on foot, be stranded in not ideal situations as they make their way towards a country like Canada, where they hope all their troubles would go away, and that would be the dream come true, a safety, security, a prosperous future for their children. And so that journey is not a happy journey, and they're not coming by choice, they're leaving everything behind. And when they get here, they realize that the system is broken. There's precarious housing situation. There isn't enough space. There's many refugee immigrant families report that there's a lot of, problems like bed bugs or not having enough money to put food on the table. They don't know about the food banks. The kid goes to school. The family doesn't have the language skills. The kid doesn't fit in school, and unfortunately not always is the public education system equipped to deal with those kids. So many kids were like, okay, let's put this kid into counseling, and they just they get enter a completely different system, and they don't get even a fair start in the system. So as immigrant and refugee mothers, they often come from places where gender stereotypical roles don't allow them a lot of social mobility or confidence, or they don't have the capacity to interact with the outside world, ask for support, or even do the day-to-day tasks which women and mothers here would be doing on a daily basis. They need support, they need assistance. And the system, on the other hand, so they're in their house with a lot of people in a small room with bed bugs, let's say, and the kids are unhappy at school and they don't want to go to school. The young children, that's another story. That's a completely different box, like how to get the culture shock out of the way, how to find a median road which has the values that are here so that the kids don't feel like they're misfit in this society, and then also having their own religious, personal, cultural identity ingrained in the children. So they're here, and the public services are at a different place where there are people in the offices and they want families to come in, ask for support, register, fill in the required documentation. So the families aren't always able to do that. So in our work, we find that many times families slip through the cracks. They just slip right through them. They are not accessing public benefits. They don't know there are food banks available. They don't know that if they get a call from the school, they could actually engage, interact, and deal with it, or advocate for their child the way that they should, or perhaps the way that they could if they were speaking their first language. So it's very difficult. People are scared of their children being taken away. They don't understand how the system works that way, so they can't even discipline their children. So newcomer and refugee mothers, they deal with a host of issues. I came in with a great job. I came in with all the language skills and the confidence to deal with my child's school system. But I'll give you a personal example. Like, I went to the school board's office and they asked for so many documents. I didn't have them. It took me 3 rounds of visits to the school board office, right? And I had a car to do that. People aren't able to do that. And dragging around 3 kids to and fro when you don't even understand what documents the doctor requires or the school board requires, it's challenging and it's difficult. And I haven't even touched on racism and discrimination yet. It's there, it's very real. People deal with it every day, especially women, especially mothers, because they deal with it at their level, access to employment level, and they deal with it when it happens with their children who don't know how to articulate what's happening to them. So I'm just going to take 1 minute and talk about the work that my organization does. So I work with the Mothers Matter Center. It's a national not-for-profit that works with low-income, isolated, and vulnerable mothers in refugee and immigrant families across the country. You can look it up online, and there's some flagship programs that meet families where they are. They're home-based programs with entry points in early childhood education. So there's home visitors, and it's a home-based program. And our partners help families prepare their children for school, and they give the mothers the tools, capacity, and in time confidence that they need to navigate the system as they settle. So I'm going to conclude here, and I'll be happy to answer any questions at the end, but just to reaffirm everything that Sarah said and more. So building back with COVID, it gives us time to see that the system was broken. It was broken for women all around. It was broken for mothers, especially women who have practiced a certain religion, who have a different skin color or a different eye color, and they have children, and more than one or two children, and it looks different. So the system really needs to take stock and listen to these voices, and there needs to be a consistent, continued investment with a feedback loop where a study like this, these can continue to happen periodically while the investment keeps coming in. Because an impact like this, when the artwork Sarah shared at the beginning, it takes years. It took years for people to reach the level they're at, and it's going to take years to go back. So I'll stop at that, and thank you so much for listening.
Thank you so much, Isra. Next, we're going to hear from Arij.
Thank you. So thank you to Dr. Sarah Shah and the Canadian Council of Muslim Women for inviting me to reflect on this groundbreaking report. As a new academic at McMaster University, I want to start by acknowledging how hard it is for researchers in Canada to get disaggregated data. This report provides us with a snapshot of the Muslim experience in Canada, and I am grateful for the countless hours of work that went into making this research possible. So this is actually Dr. Shah's second major contribution to the literature on sociodemographic trends of Muslims in Canada. In her first report titled Canadian Muslims Demographics, Discrimination, Religiosity, and Voting, we learned that Black Muslim women reported experiencing disproportionate rates of discrimination in banks, stores, restaurants, when dealing with the police, and when crossing the Canadian border. One of the most important findings in the first report was that Muslims in Canada have the lowest income of Canadians in comparison to those of other faith affiliations. We know this to be true, given the growing demand for Muslim-specific food banks. In this second report, Dr. Shah provides us with even more granular data. That is, that single mothers, Black Canadian and Chinese Muslims are struggling even more than their co-religionists. So in my few minutes, I hope to highlight the experiences of Black Muslims to flesh out what we know and what we need more knowledge on. I'm going to present two micro cases. First, the reports of multiple Islamophobic attacks against Black Muslim women in Alberta. And secondly, the disproportionate rates of single motherhood amongst Somali Canadians. But first, some numbers. So Black Muslims comprise about 9% of the total population of Muslims in Canada. So if only roughly 1 in 10 Muslims in Canada are Black, how might we explain the fact that the reported incidents of Islamophobic attacks in Alberta occurred almost exclusively against Black Muslim women? It is clear that these Black Muslim women attacked in parking lots and while waiting for public transit were targeted for a particular reason. And this has to do with the way that the contested category of woman has been constructed. So a bit of history. One of the biggest impacts of the transatlantic slave trade is that it produced Black men and women as fungible, which means interchangeable. So Black women were expected to do both reproductive labor as well as labor outside in the fields with men. Black women have never had to fight for the right to work inside or outside of the home. This labor was always expected of them. And in fact, they would also support the later integration of white women into the formal labor market. So those of us who are Black experience a different construction of gender and gendered expectations than non-Black groups. The gender binary simply does not apply in the same ways. And this is a legacy that impacts Black Muslims, whether we have enslaved ancestors or not. We see this type of fungibility reflected in Dr. Shah's report, particularly in the focus groups where Black Muslim women noted familial expectations of contribution of labor, both inside and outside of the home. We saw that Black Muslim women earn a greater share of their household income, illustrating again the ways that gender relations differ within Black families. So it's important for us to always recall what Dr. Christina Sharp says is living in the wake of transatlantic slavery. Whether it is our personal history or not, we as Black Muslims are impacted by this legacy. So to bring this back to the Black women who were attacked in Alberta, there is something particular that is happening there. I argue that Black Muslim women, those particular ones who are being attacked, were being disciplined into a category of womanhood that they are otherwise ejected from as Black Muslim women, as Black women, while they simultaneously faced anti-Muslim hostility. We need more research to understand their particular experiences of double violence. So my second point is about Black Canadian Muslim single mothers, which was highlighted in this report. So again, let's recall that only 9% of Muslims in Canada are Black. About half of that, or 4.5% of total Muslim population in Canada, are Somali Canadian. So Somali Canadians have the distinction of having the highest rate of single parent households in Canada. About a third of Somali families are led by a single parent. Out of all Somali Canadian children, about half of them are raised by a single parent, mostly mothers. So there's limited research on the phenomena of single motherhood among Somali Canadians. And while there is some discussion, most often Somali Canadian women are inserted into a broader story of most immigrant women. That is, that they immigrate from cultures of low gender equality and are empowered by the gender egalitarian culture of Canada. And once they're here, they're free to choose differently. As the daughter of a Somali single mother, I can assure you that that is not our story. The women I come from were empowered in the many contexts that their transnational migration story led them to. So this includes Somalia, Saudi, and now here in Canada. What if we reject the story that frames Canada as our savior? What if we choose to acknowledge different ways of being as not unequal, but different? What happens when we consider that there are plural ways to have equality across genders? What stories, what areas of intervention, and what thinking become possible for us then? This is the work that Indigenous scholars and communities are doing as they decolonize research on families, including the difficult topic of violence in family. So for example, Dr. Kathy Richardson, a Métis scholar who uses an Indigenous cosmology to alter the ways that institutions such as child welfare, which has historically and continues to greatly harm Indigenous families, interacts with them. Professor Richardson's work demonstrates that transformational justice is possible through her practice of circles of safety. We have our own histories of colonial violence that relate to and are separate from what happened here in this land. We need to understand these genealogies so that we can tell our stories differently. We need more research that can complicate the story about Somali Canadian mothers in Canada. Otherwise, we risk erasing the ways that Black Muslim Canadians have survived in their mothering and caregiving roles. So in summary, I thank Dr. Sarah Shaw and the CCMW for providing this important research and for making space for this conversation. I hope that we will have many meetings such as this one. Thank you.
Thank you, Arij. I'd like to now invite Arfa to share her thoughts.
Thank you, Sarah. And thank you, the Canadian Council of Muslim Women, for putting such an important discussion out in the International Month for Women. I am going to echo strong statistics that were put forth by both Yusra and Arij. Numbers don't lie. We're all here. We're all part of statistics. We're all part of the story. Each one of us has our own narrative. Mine is a first-generation immigrant. I came with all the backing and tools that I was given to make Canada home and to provide for both myself as the family that I came in to utilize that journey to mark my own story. And I was hit with hurdles, just like many other that are hit with the same hurdles, and especially if you come from the Muslim background with no language as your backup, no educational background, and no awareness of the situation that meets you on the other side of the fence when you're coming from east to west, you're hit by challenges that are beyond conception. You're hit by natural hurdles that come by your way that you are not trained to handle. I'm extremely passionate about working with women in terms of advocating for equitable employment as well as careers. No, you don't have to take your hijab off to find employment. You don't have to generate a name to become an equitable candidate in terms of the hiring process. No, you don't have to put shame to the fact that you are a mother. You don't have to conceal the fact that you are a single mother or you have multiple kids in order to find that space for you in the employment zone or the workforce. We've seen many stories, including my own, where you have to go in and take force or take charge of the conversations yourself and carve spaces for yourself. Often enough, people of color, ethnic backgrounds, especially Muslim women that represent the marginalized population, aren't equipped to fight the battle. Not only does it start from the external workforce environment, but it all starts and stems from the homes and the communities that they've lived in. We have to educate and raise awareness to the children that we are now grooming and are responsible for to make sure that they have a voice that can be heard, that they can occupy a space so that they can make their zones, they can lead their zones and not be sabotaged by what the community says or what the stereotypical image is of a Canadian young Muslim woman or a Canadian single mom who's trying to make her space in the Canadian workforces. My personal story, and I've shared it on multiple platforms, and I'll share it here again. Coming from a privileged background back home in Pakistan, with a post-graduation degree, as well as international work experience, I did face my barriers towards equitable employment on the Canadian soil. I had to plow down doors, knock on doors often enough, break down the barriers of communication and misconception in order to get my voice heard and in order to get a seat on the table that was going to be uh, uh, an equitable match to what I had done in my past. And it was not easy. It took me 3 years to find that space. A lot of us give up. A lot of the Canadian Muslim women that dream of becoming a part of the labor force give up even before they've started because they don't believe in themselves. I strongly encourage anyone that has any doubt in your mind that you are not worth it, you are worth it. All of us have our stories. And I see from the chat, never give up. Yes, that's the motto. Your biggest believer, your biggest cheerleader is going to be yourself. And all of us, when we leave our homes and come to Canada to make it our homes, you often use or lose our cheerleaders back home. You're giving yourself a new start in a new place with no support structure and no framework in order to assist you, whether it's social services or it's your own community. So become your own cheerleader. Occupy those spaces that you think you couldn't occupy because you invest in yourself. I can tell you now, I've been in the country for 13 years. And each spot that I have occupied, I have carved the spot and made sure that I have been given a space on the table. I never asked because I knew I was going to be meeting with stereotypical assumptions around what I could bring to the table. But I invested in myself and I made sure that I carved those safe spaces where I can go in. And I'm hoping that with my journey in the social services sector, that I can advocate, I can inspire and empower those that are looking to have those safe spaces carved for themselves. So thank you, Sarah, for having me. And I look forward to the rest of the session.
Thank you so much, Arfa. I'd like to now invite Mona to share her thoughts. So,
Assalamualaikum. I'm sorry, I was just fighting with my laptop. Thank you, everyone, for all your words so far, and thank you to everybody at CCMW and specifically to Zada for creating this space. Before I begin, I do want to honor and acknowledge that I'm currently situated within Treaty 6 territory, a home place and for many Indigenous nations and communities, including Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux peoples. As a daughter and granddaughter of Palestinian refugees, I intimately know the intergenerational reverberations of settler colonial violence and injustice in my family. And I'm committed to my responsibilities as a settler on these lands and as somebody implicated in the ongoing genocide against Indigenous peoples and communities through that relation. And I'm also committed to my responsibilities as a treaty person and as an educator for justice. So I'm a narrative inquirer, and this means basically that my research is story-based. And so tonight I'll be sharing stories and insights from my life and research alongside Muslim mothers in specific, including those with refugee experiences and those who, like me, are mothering disabled children. So when I was planning what I was going to share today, and I'm a last minute person, so it was literally last night, I was like, what do I really want to focus on? But I really couldn't help but think about the recent news coverage, as Sada mentioned earlier, and mainstream discourse about the heartbreaking situation in Ukraine and that Ukrainians are facing right now, and how different the discussions related to brown and Black people around the world resisting injustices have been. I couldn't help but think about the silences and the erasures. I couldn't help but think about the pushback to brown and Black refugees, recently and across the decades, and the difference in the discussions currently. And I keep thinking about dominant narratives and who is deemed worthy of care, of safety. So it's important to remember that our work is intersectional. And I really appreciated that about your work, Sada, your most recent report. So when I'm talking about intersectionality, I'm specifically referring to the work of legal scholar Dr. Kimberly Crenshaw and how she conceptualized it over 30 years ago. And she keeps building on this conceptualization. And Dr. Crenshaw discusses how Black women in America experience oppressive systems of sexism, misogyny, and anti-Black racism, and how these systems and others converge in unique ways. And more recently, she and many others have discussed how violent systems of settler colonialism, anti-Black racism, anti-Indigenous racism, anti-Asian racism, anti-Palestinian racism, ableism, colorism, misogyny, homophobia, transphobia, poverty, classism, Islamophobia, and anti-Semitism, among many other systems, intersect and are experienced in unique ways. So it's really important to remember that Dr. Crenshaw, when she's talking about intersectionality, it's not about being additive. It's this and this and this. It's as if you can stack these experiences. She's talking about how people are located in these intersecting systems, and that they are experienced in different ways depending on what systems that you're located and the context of where you're located. So several years ago, I inquired alongside other Muslim mothers and daughters, as the daughters were in the process of transitioning into adolescence. One mother-daughter pair were originally from Afghanistan, another participant pair were originally from Somalia, and the last participant pair were originally from Lebanon. And so while we're all Muslim women, and I included stories of myself trying to navigate my daughter's transition into adolescence. And she's turning 19 actually in a few weeks. And I just started that research when she was about 12. So subhanAllah, how time does fly. But we were all Muslim women and our experiences are incredibly different. Yes, we all navigated gendered Islamophobia and other types of racism. But I really think about how the participant pair who were originally from Somalia also navigated anti-Black racism from within Muslim communities. And we're also all navigating stories from within and across Muslim communities and within and across other communities we're a part of what a good, Muslim daughter, girl, mother, woman should be like, who's a good citizen. So in my most recent research alongside Muslim mothers who arrived with refugee experiences, and I really try to be careful about that framing, not name people as refugee mothers. And the reason behind that, as much as possible, because I probably have already said it, but I really try to be wakeful to that, is because that's being a refugee is not your identity. It's part of your experiences. So these mothers were also caregivers to children with disabilities, like myself. And so although, I'm an intergenerationally, my parents were refugees, my grandparents were refugees, I've never experienced, I've never had that experience of having to be violently displaced and dispossessed from my home. And so I had to acknowledge the vast privilege that I had, being from the, being born on these lands, yes, as a settler, but also somebody who is really well versed in the English language. Thankfully, alhamdulillah, my parents were able to give us a good life, as through their, their tenacity and their heartbreak, to be honest, because they were here without any family. And so I always think about that as I think about how not only, do mothers, Muslim mothers, of disabled children who arrived with refugee experiences, they face the challenges and the hurdles that other immigrants, and of course we have to separate and differentiate between immigrants and those who arrived as refugees, because yes, although there are overlaps, it's extremely different. And so I also think about the ableism and classism within and across Muslim and larger communities as well. Think about my participants' children. One of my participants' children. She has 3 children who are now 16, 14, and 12 years old. And she also had a newborn pretty recently. But one of her children has cerebral palsy and another is hard of hearing. And the eldest is constantly being asked to translate and bridge gaps between his parents and school and service providers, because for whatever reason, it seems to be really difficult for them to generate, to just be able to get the services, the translation services that are needed in their advocacy across different institutions, including schools. And I always think about her. Her pseudonym is Fatima. And when I was discussing her experiences with her one day, I'll never forget, this is something that just has stayed with me, how she said, she was discussing one of the experiences where she was made to feel like she doesn't matter. And she says, quote, "You know how it is for refugees. They don't see us as human." And so that's just one example. And these are just some of the participants I've been blessed to learn from. But their experiences have taught me that, they're navigating so many intersecting systems of oppression, as well as social media, as well as mental health, as well as, the dominant narratives of who they are or quote unquote should be, while trying to build their lives alongside others. So alhamdulillah, I do want to say that, they do have these challenges, but there's also the vast amount of strength. And I'm always challenged between trying to say, there's so much joy and strength and resilience and, resistance to some of these things, but also not romanticizing that, right? Like these are very real challenges. And so I invite you all to think alongside some of the stories that I shared and the other participants in this panel discussion are sharing. And collectively think about how we might all learn from these stories in ways that better support diverse Muslim women, as we simultaneously work to change the dominant narratives and intersecting systems that are profoundly shaping our lives and the lives of so many others. Inshallah khair. Thank you.
Thank you, Mona. I'd like to invite Natasha to share her thoughts as well.
Thank you, Sarah. So I'd like to, first of all, thank CCMW for, again, creating this space, and Sarah for your incredible groundbreaking work, which is badly needed on the situation of Muslim women in Canada. First of all, I just want to make sure you can hear me. Okay. So Sarah and Yusra have already discuss the impact of various barriers faced by newcomer and racialized mothers when accessing the system and services for help, or even regular day-to-day contact with healthcare system or education system. The additional things I'd like to touch upon is the particular challenges faced by women in abusive domestic situations, or women seeking to leave their marriages and having to navigate or make the choice about having to navigate the family court system. In addition to the obvious lack of information that newcomer women have, which again was touched upon, is by Yusra and Sarah, is the biggest difference that I see between Muslim women or on a broader level, Muslim women and immigrant women, and women who are white, is the lack of community understanding and the lack of community support. And there is a world of difference that I see when a woman who is white or from the local community, as it's called, goes public about their domestic situation. And when you have women from a marginalized community, and this also applies to Black women, Indigenous women, this is not unique to Muslim women, but we have unique barriers of our own, but this is a similarity, that there is a lack of understanding and even a lack of empathy, because it's often phrased as it's almost as if you chose to be in that situation because somehow you chose your culture. And this is a big difference, which I would say deters women from leaving abusive situations, deters them from accessing the family court system. And this visible lack of support that you see when Muslim women are, either want to leave or trying to leave, and you have this visible lack of support, and this is treated like a personal weakness and or flaw. And it's actually weaponized against these women by the aggrieved partner, by their family, by their friends, and even by service providers who may have been reluctant to do their job properly or to the fullest extent that they could have, because they were unable to understand or unable to relate, or it was just too weird for them. And because of the lack of ability to provide effectively for this particular situation, you end up having this lack of support is used as a weapon against these women. So when you take this already vulnerable situation of Muslim women in these situations, and in addition, you add to that, you put these women in rural communities or in provinces that are newer to immigration. When you do that, the burden that you place on them to not only have to navigate the family court system, which they don't know, didn't grow up understanding, but to actually manage a domestic situation without the support of the women's networks that are available to white women. So you're just adding so many challenges to a person who's already in a challenging situation. And that just essentially, they are faced with lack of acknowledgement about any inadequate or even counterproductive services that they might receive from a multitude of systems. We're not talking just about the family court system here. We're talking about healthcare, education, all of these, places which should have supports that women and children can access, but because it's something they can't relate to and they don't understand, they're not provided. And when they're not provided, you run up against the fact that they're unwilling to acknowledge that they did not, in fact, provide what was needed. And that leads to hostility. So you have additional problems that sort of, heap up on women in these situations, to the point that it's at this point they're thinking, how can I possibly leave a situation like this? Because every time I ask for help, I don't get the right help, or I get help that doesn't work. And then instead of people thinking, systems are slow to change, we know that. So then you have people within systems who are, instead of thinking, well, maybe we should go back and try to do it differently, because, even if there isn't a lot of data in Canada, which, thank you, there is some data now. Even if there isn't, it is available in many other places. It's available in the UK, it's available in the US. Instead of doing that, their go-to response is instead to say, you didn't ask for it properly, or you didn't know how to access it correctly, or maybe you just didn't do what you were supposed to do. So this sort of, again, creates so many more issues, that you have people who are reluctant to access the family court system. And I've noticed that there is a sort of prevalent dialogue, which is Muslims do not want to integrate. Muslims do not want to get, access support from systems. They do not want to do things the way that everyone else does. So this feeds into that narrative. And the fact is, what is not looked at is, it is not that Muslim women, not always that Muslim women just reject, the Canadian system. It is because the system is functioning in a way that it's so difficult for them to access and get any kind of positive response. To go off on a tangent here, I'm from a rural community. I'm from New Brunswick, and the only women that I saw, Muslim women that I saw, who actually went through divorces and family court, none of them were successful, as in zero. That is highly unusual. That is not normal, that women who were primary parents suddenly lost their children, or had to, have a very sort of difficult to negotiate joint access, did not get any financial, support that they needed. This is highly unusual. This is not typical. So that makes you wonder, why is there such a different sort of response when Muslim women are seeking support from systems? And it can't all be placed on them that they just didn't know what they were doing, because a lot of other people may not be knowing what they're doing. We don't have we don't have the information, but there are some things we don't have problems with, like addictions is not an issue in Muslim families. So a similar sort of outcome is seen. I don't have the statistics to back this up, sorry. Don't have the statistics to back it up. But if you were to compare the responses seen by healthcare providers, education, and family court services, emergency services that are received by Muslim women, it would be comparable to white women who have addictions issues. Because you hear the same stories when you're accessing the shelter, whether you're volunteering with a shelter, you hear similar stories. And again, I don't have the data to back this up, but this might be something to look into. So this lack of opportunity that is faced by these women is seen as a sort of a godsend by their partners to further disenfranchise these women and keep them in a dependent position for as long as they possibly can. Therefore, I would say that the lack of relatability, I would call it relatability. It's not just understanding, because anyone can, open a book and try to understand the barriers faced by Muslim women. They can, look for research if they want to. We're not at that age anymore where you have to go to libraries and do research. Everything is available at your fingertips if you want to look at it. So I wouldn't just call it a lack of understanding. It is a lack of relatability. That it's too different. Our culture is too different. It's too difficult to understand. And why do women put up with it? And it's a lot of these questions which are unreasonable, I would say, because it's not just that women suddenly woke up one day and said, you know what, I choose this. It is who you are. It is who we are. And, we all are different. We practice differently, or we have different understandings. But even though there is a diversity amongst Muslim women, the fact is, this is who we are. And expecting us to just turn it off is ridiculous and offensive. But again, I would say that this lack of community awareness actually facilitates domestic abuse. It facilitates domestic abuse of women and children. And it does this by othering them and putting them in a separate category where this is almost something they have to live with. In my community alone, it was New Brunswick. The differences in support received by immigrant women was so rampant that the local family violence center actually applied for a national project to assess the differences in services and support. And I was on the advisory forum for that. And I did notice when all of the women from different backgrounds were there were similar stories because they were not, everybody was not the norm. That was the commonality, that we were not the norm. We had different backgrounds, different understandings, different. And so at that point, you start on the same point together, that all of you are not the norm. So we created protocols. This was to help service providers understand when women are different, whether it's a different culture, different language, different experience of domestic abuse. How can service providers respond in a helpful, effective manner? So at this point, it was a good stage where you had women with similar outcomes, if not the similar reasons for those outcomes. But from that point on, the project ended. And at this point, you had a group of immigrant women who tried, the initial point was, let's keep continuing a space where if immigrant women need support when they are accessing systems, they will have it. And that is where I noticed that being Muslim, we were still seen as other, even within that immigrant space. And I heard a lot about, these are Muslim problems, these are not immigrant problems, which again is weird because it's not like, being Muslim somehow, deletes you as an immigrant. You're no longer an immigrant, you don't count in that way. But it was othered even in that space. And that is when I felt that being from, rural communities, or being from communities that are not used to having, a strong Muslim population, or even having children from, second generations and third generations who are at that point accustomed to Canadian culture, understand it, and can navigate it, even if their parents cannot. That is when I realized that we actually need a national network to support women and children who are facing these situations, because it is a big ask to ask people to do this on their own. And it is critical to have a national infrastructure to put this in place, so it's not such an uphill battle for people trying to go through it alone. So those are just some of my observations about what I've seen over the years, volunteering in almost everything I could, to see, what could be done, what was available, and why we were having such a different outcome every time, whenever you're accessing services from even other immigrants. Like it's a step ahead or a step below, I would say, from even other communities. So thank you.
Thank you so much, Natasha. That was quite eye-opening. In Ontario, we don't quite have the same kinds of patterns. Not anymore, I think. I think what you're experiencing there might have been like a few decades in the past. I'm just going to mention as well that we've now concluded the structured part of the panel. We're going to open it up now to the question and answer session. I'm going to enter into the chat box the topics that everyone spoke to. So if you want to direct one of your questions to the scholar who shared today, feel free to. I'd actually like to start with the concept of Muslim exceptionalism, because that really came up in all of your talks of especially in Natasha and your sharing of how Muslims are sort of seen as like this other. Muslim exceptionalism is a concept that was developed by Abdul Mohammed Kazimpour, and he writes about it in his book, The Muslim Question. He talks about this this framing of Muslims as being somehow unassimilable. It's a hard word to say, that Muslims somehow, like, they can't be assimilated. I actually took that concept and I took it to the literature on health, and I found the same thing, that across studies on health care on Canadian Muslims, that Canadian Muslims are framed as somehow like a special category of people who their Muslimness gets in the way of their health. And they would make these claims when it didn't quite make sense either. For example, fasting. There is a scholar who said that Muslims would fast even when it's not good for your health, when Muslims know that's not a thing. Like, we don't do that. So the assumptions that were made about Muslims without conferring with Muslims, this Muslim exceptionalism. I see there's a hand up. I'm just going to ask you to unmute because I can't hear you.
Hear me now?
Mhm.
Can you hear me now? Assalamu alaikum. Peace and love to everyone. I am happy to be on this program, and I thank you all for getting a program like this. And I would like to say that I'm hearing everybody talking, like blaming the whites all the time, you know, like the white this, the white that. I don't know how you see me, but I'm a Muslim, and I came as an immigrant. I came as an immigrant 30-something years ago. Just me, my son, and my husband. I had mental breakdown for 17 years. I worked in the factory, and I did a lot of volunteering. There were no mosques in Guelph. I helped advocate for mosques with other women. I helped to do networking with the visible minority women, and I helped to do a lot of volunteering at City Hall for refugees. And I'm a homemaker. I don't have a university degree, but I managed to keep my marriage intact for 42 years, though I had mental illness and a lot of problems before. And my son, he turned out to be a computer software engineer. So at the age of 62, I am helping my neighborhood kids, the working moms, because I live in a middle-class neighborhood, but children are growing hungry, regardless if they are Muslims, white, Hindu, because I have a wide variety of different races in my neighborhood. And children are going hungry because the moms are busy working. And when they come home in the afternoon, when the children come from school, they're hungry. Mom is hungry, mom is tired. So what I do, I mentor kids in my neighborhood. I would cook and feed my neighborhood kids. And I always tell the parents, to get the children in Islamic school, they must know a little bit about spirituality and the principle of Islam in order for them to grow up healthy. And there are few moms who are single moms, and I would tell them to have good communication with their partner or their spouses, and allow the child to be with the father for a little while, because the child needs to grow up healthy. And there are programs out there where the Muslim mothers and refugees are accessing in Guelph. They have the YMCA, they have the Sheldon Center, and the Muslim, it's not like back before 30 years ago. The Muslim people are doing interneting work, where they are together, the Muslim, whether they're Afghanis, Pakistanis, Arabs, or whatever. They have to do networking in order for them for survival. That's all I have to say. And love. If we give moral support to each other, moral support. We do a lot of networking and give moral support. Love. Children come at my door because they're hungry and because they need hugs and kisses. They need love. And that is what is lacking today, the love for our kids. Sometimes we love animals more than kids, but we should be able to love our kids. And although the parents are separated, there should be some sort of communication for the kids to strive.
Thank you.
Thank you for listening.
Mona, you have your hand up.
Yeah, so I'm a teacher educator at a faculty of education here in Alberta. And one of the things that I have to always push back on is this idea of blaming the whites, or, why is everything about racism? And I really want to say thank you so much to the person, I'm sorry, I didn't catch her name, who just spoke up. But I do think that one of the things I constantly tell my students and the future educators is we need to stop being more offended almost at the naming of the racism rather than the actual racism. Yes, alhamdulillah, there are many areas where we're blessed, where we should be grateful, but there are many people struggling under these systems that were never designed for them to succeed. So we need to make sure that we're removing as many barriers as possible, and that to start that process, we need to name the things that are impeding them. So I just really wanted to say that.
Thank you, Mana. If audience members have questions that they don't want to say out loud, they can also type them into the chat box.
Can I ask a question?
Yes.
Hello, my name is Malika.
Hi, Malika.
Yes, can you hear me?
Yes, we can hear you.
Yeah, my name is Malika. I have been hearing all these, your Dr. Shah and Natasha Akhtar, and the research has been done very well. I'm here, I'm a Muslim woman from Pakistan. I have a son who was born here. He, mashallah, did his education in McGill, and he is okay, they have a good job and everything. But sometimes I volunteer for my people, and I see that, yes, the religion, as when I compare our women and our families, religion is becoming a big obstacle. It's not. I'm not saying that, like the other speaker said, that this is the way we are. This is the way we are. But we have to learn also. So the learning and changing is in our community, in our Muslim society, is very difficult. Whether sometimes it doesn't conflict with our religion, with our faith, with our beliefs, but sometimes the traditions, the customs that are not actually in our faith. So like the children, I go with my mothers to the school for the translation sometimes. So the teachers say, why don't you send your child your girl for the swimming? Oh no, we are Muslims. I cannot wear the swimming dress, the swimming costume. My daughter, no, we are not, we don't allow that. Okay. So the overnight picnic, the overnight outings, oh no, it's a mix of boys and girls, grade 4, 5, 6, or whatever. No, we don't allow that. Okay, then the girls become teenagers, 17, 18. Now the question of boyfriend and girlfriend. And again, there's a it's a big problem in the family. It causes depression to everybody in the family. The girl is ready to go to leave the house. 16, 17 years old girl is ready to leave the house. And the whole system supports the girl. Yes, madam. Yes, madam. This is the way it is. And the whole system supports the girl. When the girl, she's very tender age, 16, 17, 18, 19. She's very happy that the system is supporting me, and she doesn't care for parents. And the parents, they get into depression. So all these things, like I guess Natasha said, that we are considered as others, even not like in the immigrant category, we are considered others. And this is very difficult for us Muslim women, especially, and the mothers and our girls and daughters and sons. And once there was a woman who was fasting, and she has to see a social worker. It was a breaking of the fast time, evening time, and she was talking to the social worker, and suddenly she said, Madam, I have to break my fast. Give me 5 or 10 minutes break. She went out to eat some water, to drink some water or some dates. And I was there with the social worker. Oh, the social worker said, oh, these people, they disturb our system. My time is being wasted now. She's out for 10 minutes to break her fast. These people should stay in the mosque. These people should stay in the mosque who want to practice their religion. So once I was with some white woman traveling in a car with her. And there was a restaurant, a halal restaurant. We passed by a halal restaurant, and she joked. She said, "Yeah, this is a halal restaurant." I said, "Yes," and she joked with me. It was a joke or whatever. She said, "When is going to be? When it is going to be halal pig? You will have halal pig anytime or any in the future?" I said. She taunted at me. Once I was in the store, and there was a sampling. They were sampling the store food. When they introduce new companies. So they said there was a sampling going on. There was a man at the table, and I stood there, and I said, "Okay, what is this? What is the ingredients?" He said, "This," and that was there was a ham or pig and something. I said, "No, I'm Muslim. I don't eat this." Oh, he said, "Why don't you eat this?" I said, "No, I'm not. It's my faith. That's it. I don't eat it." Oh, because you don't have pigs? Because in Saudi Arabia, it's a hot country. They don't have pigs there. That's why you don't eat. So it's very difficult for our children, young children, teenagers, even older children, what they go through when, as a Muslim, what they go through, and they cannot express their feelings to their parents. They are ashamed of the society. They are ashamed of the parents, and they are being affected a lot.
Thank you,
This I
Malika.
want to say.
So thank you so much for sharing that. I'm going to move us along just because I'm very conscious of the time. And please don't hesitate to continue to participate.
Thank you.
I'm actually going to now redirect the conversation a bit. Natasha has her hand up, but what we're hoping is that instead of comments, it's good to comment, and you can use a chat to do the commentary. But in the interactive part, if you could please ask questions of the panelists and the topics that they've discussed, that would be really helpful, because we really want to give as many opportunities as possible for people to ask the questions of these amazing women who have shared such a lot of different experiences and knowledge with us, and I don't want to miss that opportunity to ask them questions. Go ahead, Natasha.
Yeah, no, I agree with the question format. I was simply going to clarify. I think the lady before brought up the point that I made, that this is who we are. We are Muslim. And I was not really referring to the fact that people, she brought up that Muslims have traditions that they should, consider whether those are helpful to them in a new environment. I wasn't actually referring to our traditions, because I think it's very important that we are in a country where we have the freedom of choice to decide which traditions are workable for us. And that does not mean that we give up our identity as Muslims. And that doesn't take away from our identity as Muslims. But when I say this is who we are, I'm referring to the otherization that you get from the community, not just from the white community, but notably from a lot of other immigrant communities who are eager to otherize other immigrants, so they can sort of take the spotlight as the best immigrant or the favorite immigrant of the moment, and which is unhealthy and toxic, but it happens. And this, I find this was a response to them when they say, well, these are Muslim problems. Okay, yes, we are Muslim, and we will have problems that are related in some way to our identity, but that does not take away from the fact that we are also immigrants and we're also Canadian. So you cannot just sort of say, well, you're Muslim, so therefore your problems are irrelevant. Our problems are, sort of an intersectionality based on various factors about ourselves, and racialization absolutely plays into it. I have seen a very distinct difference in the experiences of Muslim women from Europe who are blonde and blue-eyed, who have a very different sort of experience when they're outside and Black women who are Muslim on the other end of the spectrum, which was brought up by one of the other speakers. So this sort of, the fact is, yes, we are Muslim. That does not mean you get to discount the fact that we have other, issues that are not necessarily faced by women in the mainstream. And it is not something we should be blamed for and we should be shamed for, because it's not something that, we decided to get up one day and say, well, I want to have these issues. So that's what I wanted to clarify. Thanks.
Thank you, Natasha. Very helpful comments for sure. Arid, you have your hand up.
Yes, I appreciate, Natasha, so much of what you said. I just want to add the caveat that we are limited also in our choices of how we can express our faith here, thinking here of Bill 21, which is affecting our Muslim sisters in Quebec. But I would love to learn, and maybe we'll connect another time, but what you shared during your share was very provocative. This otherizing of Muslims within the category of immigrants, as you said. And it reminds me of, there's an Islamophobia scholar in Australia named Randa Abdel Fattah. And she says, she talks about what she calls virulent Islamophobia, and that we have to, in a way, inoculate ourselves. So prove to non-Muslims that we're not that kind of Muslim. So I wonder if there's some of that happening in what you described. And I was also curious, Sarah, how you said that's maybe not what's happening in Ontario. Maybe I'm not familiar enough, but I'm curious how you made that distinction between what might be happening in New Brunswick now and what perhaps you suggest is more about past practices in Ontario versus what's happening now. So anyway, I'm really enjoying the discussion.
Great, thank you. So Sarah, if you want to go ahead and respond to Arid, I do have some comments that I'd like to share from the chat, because I think these voices are really important. So go ahead and respond, Sarah, and then I'll go to the chat box. Thank you.
Thank you, Nazit. I'll actually let Natasha respond first, because Natasha, would you like to respond first, or should I go?
I think that, why don't you go ahead and then I'll follow up. Go ahead.
Sure, yeah. So this actually came out of a side conversation that I had with Natasha, comparing and contrasting the experiences of Muslims in Ontario and New Brunswick. New Brunswick has a much smaller Muslim population compared to Ontario. It's also, I want to say it's newer, or it seems younger
It's
somehow.
newer, and I hate to use the word fob, but that's the word. It's the fresh off the boat sort of immigrant category, which is literally new immigrants who just came, are very insecure, very desperate to stay, very eager to please. And that is who the population is used to dealing with. So a lot of, because it's such a white dominant community, and a very, not just white, but very conservative, very Christian community. And there is a lot of, I would say, rampant paranoia about Muslims in general. And as a funny aside, I keep hearing about stories about women in Ontario and Alberta being targeted because of their hijabs. I am from Pakistan, never worn a hijab in Pakistan or here. And I have actually been asked, not once, but numerous times, why I don't wear a hijab. And almost as if, and when I engaged in conversation with these people who I thought were quite weird, because I was thinking, why would you want that? And it came out that they wanted to be able to identify Muslims, which is very disturbing. But that is the level of paranoia and insecurity about Muslims in what is seen as a historically strong white province, which they would like to remain that way. And that is why I see a lot of Muslim families, I would say about 50% of the Syrian refugees who were settled here have left, and typically leave when their kids hit high school, because that is when their children come home and say, people really do not like us. And that terrifies parents. As a parent myself, I can say you are absolutely terrified when you perceive your child is alone in a possibly hostile situation for no reason other than their perceived religious identity. That is a huge sort of push for parents who immediately, I've seen families who packed up and left overnight. So it is absolutely a very different situation from Ontario. I have family and friends in Ontario who I have spoken to, and they're saying what you describe is what our parents dealt with in the 70s and 80s. That's where we are right now, unfortunately. I went off, but.
So no, those were all really good points. I don't know, Arid, if that sort of, clarifies where Natasha was coming from. So if you don't mind, I would like to share some of the comments. in the chat because they're really important to the discussion. So Vicky, thank you. You were saying thank you for speaking out as a white Muslim. I've experienced racism from fellow Muslims. And, you know, Muslims are not immune to racism. In fact, I would say, as pointed out by other speakers, there's a lot of anti-Black racism within our own communities. There's a lot of anti-Indigenous racism within our own communities. And, you know, I've sort of straddled two different cultures in my personal life. And I've experienced, you know, anti-Pakistani racism from members of my family who happen to be from other Muslim backgrounds, from other, you know, racial backgrounds among Muslims. So unfortunately, this is what you know, our lives are, and human beings tend to tend to experience their lives in that way, and we've been accustomed and trained to, in fact, others, you know, based on religion, based on religion, based on their race, based on their skin color. And let's not sort of forget about our internalized racism, you know, and many of us come from communities where being white was really important, and people use whitening creams and you know, only want their children to marry people who are fair skinned or, you know, blonde or blue eyed. So unfortunately, we come from our own racist package and backgrounds. So to continue, Vicky, thank you for making that point. And then I'd like to, I know that Mona, you did talk about Vicky's comment, and you say, I'm sorry that you experienced that racism, Vicky. But she says, I think it's important, however, to remember that ism in racism points to power and systems. Absolutely. The reason why I'm raising that or reading that out loud is that we work within systems. You know, we live within systems, and systems are created by other people, you know, and they have a history of how they function. So unfortunately, when you look at systemic or systematic structures, they play a role in how people see us and how we interact with them. Absolutely. So Mona, you're saying, yes, Natasha, also important to remember that Muslims practice in different ways, and that we follow the wisdoms of our faith. Compulsion in any way has no place. Absolutely. I really like that. And thank you, Vicky. I appreciate your understanding that there is no compulsion and you choose Islam. So
I'm sorry, Nashat, can I just speak to why I wrote that? Because I think the context of why I said that is lost a little bit. So I was responding to Natasha's comment in relation to something one of the session participants had brought up. And I think for me, it's going to always be about, you know, yes, there's going to be cultural, you know, challenges. You know, I wasn't allowed to sleep over anywhere outside of my home growing up. I wasn't, you know, and there's scores and scores of articles and chapters and different podcasts about this. But I think the challenge is, how do we do better? You know, how do we, you know, navigate some of the cultural aspects rather than the religious? So I think that, of course, it's going to always intersect in how we understand our faith. You know, I'm Palestinian, and we're very culturally, you know, traditional. But at the same point, I think that sometimes, like, if we draw on the wisdom of our faith to understand that there's no compulsion in terms of, we should not be we should not be, you know, making people, can't get my tongue around the words, but we shouldn't be making even our own children, you know, follow culture and our faith exactly as we want them to as well. And that's just something I really highly struggle with, even as a parent of a young adult who's making her own decision. She doesn't wear hijab. I don't ask her to. She doesn't seem, you know what I mean? It's her choice. She chooses her things in her way. And I think that that's something that came out of my research as well, because the moms and daughters, there was 2 who did remove their hijab, and there's one who chose to wear hijab during the course of the study. So this is highly personal. It's highly, of course, it points to larger systems, But I think that if we just allowed for space for people to make their own decisions based on their interpretations, their practice, what they need in that moment as well, I think we need to allow for that.
I think that's beautifully said, Muna. And I know that, when we do our workshops, when we're talking about Islamophobia, we say that there is no compulsion in our religion. People aren't forced, and that women have their own agency and choice based on their learning and understanding. Absolutely. I really like that. So we have a few hands up. Yusra, go ahead.
Thanks, Nuzul. Sorry, my internet, I was having issues with audio, so I'm not going to turn on the video, but I just wanted to speak to this flexibility piece that was brought in. So it's so important to know that we're not here to judge people or to be judged, but it's everyone making the choices that they believe are right for them. And this leads me on to culturally appropriate services, which comes from a more systems-oriented approach that, we're talking about, let's say, mental health or young people growing up, Muslim youth dealing with various issues. Do we have, and then Natasha, you talked about, women wanting to leave abuse, and many don't go even in urban metropolitan areas because the shelters or the housing situation that they would find, it's not culturally appropriate for practicing Muslims. So, and I know Sarah's report points to it as well, that we really, because Muslims are here, there was a study that showed it's the fastest growing religion in Canada. There are women, there are young people, there are children, and we do need culturally appropriate services all around. So yes, respecting when Ramadan is going on, or prayer times, or a way that we want to raise children, youth counseling helplines, which are culturally appropriate, and Muslim organizations could have funding to run them. So I know organizations like Nisa Homes do shelter work, but the capacity is limited. So the support can come through Muslim organizations who provide inclusive and holistic services, wraparound services, and they are culturally appropriate. So I'm just going to leave it there, that's a huge need across board.
Absolutely. I understand Muna has to leave us because her daughter's has come home. So motherhood in full view. Thank you, Muna, for everything that you've shared with us today. All right, any more questions, comments? I know I've gone through the chat box and really appreciate your comments and interactions with us. Any final sort of thoughts from the panelists? Sarah, from yourself?
I'll take a moment to organize my thoughts. So much was shared. I feel like I'm sort of swimming in the richness of this conversation as well. I want to sit with the recording and almost analyze the conversation that was had to follow this through again. I think that we need a lot more work, a lot more research to understand the experiences of Canadian Muslim mothers and the way that it really manifests. I did a little bit of a deep dive into the literature to see if I could find material that focused specifically on Canadian Muslim mothers, and I really didn't find much. And so I contextualized this conversation by drawing on theories and of gender and race to understand it more deeply in terms of a social system. But this entire conversation has made me realize how badly needed research is on this.
Absolutely. So maybe, our next funding proposal should be on Muslim mothers and their challenges, but also how they navigate through the systems. Absolutely. I really like that. And of course, there's very eminent scholars and community partners here who could share their input. Absolutely. So I really appreciated everything everybody said. Here we are on the heels of International Women's Day, and this is Women's History Month. And we all, before the session began, we were talking about our mothers and, how they impact our lives. And, I'm a mother and a grandmother myself. So I really feel that we do need to learn more about all of the challenges of mothers and daughters, and grandchildren and granddaughters. So inshallah, we'll have an opportunity to explore further in future research. Just a few things that I want to share with you that relate to the work we're doing and the discussion that we had today. So, we do anti-Islamophobia workshops, and one part of it is, gendered Islamophobia, and another part, very important part, is intersectional identities and how that impacts Muslim women's lived experiences, particularly those, who are racialized, who are Black, who have disabilities, and who are, trans or non-binary. And those experiences are very different for each one, and it's important for us to share that. So that's in that particular education we do, and it's really a lot of non-Muslims attend that. So if you haven't attended one of those, please do attend. And what I learned today and what you shared today could actually inform what we are imparting during those workshops. The other thing that I wanted to mention, Natasha, so you'd be very interested in knowing that that CCMW is got a new project on gender-based violence. And any of you who are interested could reach out to us and we'll tell you more. But it's really looking at systemic barriers that exist in providing services to women Muslim women and girls who are experiencing gender-based violence, whether it's inside the home or outside the home. And we are going to be doing systemic reviews of organizations that provide services and supports. And we're also going to create a guide for service providers, employers, others to design programs and systems that are positive for Canadian Muslim women and girls and non-binary individuals. So stay tuned for more information on that. But again, I'm going to pass it back now. Sarah, do you have anything to say before Nina says her thank yous and her part and her dua?
Not professionally. I just want to say hi to my mom.
Is she here?
My mom's on the call.
Oh, well, my goodness. Will you introduce her to your mom?
She's very shy. I'm not sure if she'll speak, but salam, Mom.
Assalamu alaikum, everybody. This is Sarah's mom, and I'm so happy that everybody is so knowledgeable. All the speakers, oh mashallah, very good. And I'm so proud of especially my baby. She's the youngest. I always call her Bubby.
Well, we're very, very proud of her. So can I call you Auntie Parveen?
You can call me anything you want. You can call me Mom.
So we're so happy you're here. And all the moms that are here, all the daughters that are here, sisters, and granddaughters and grandmothers. So thank you. I'm now going to pass it on to Nina for some final words. Nina?
Assalamu alaikum, dear friends, and Auntie Parveen. On behalf of the Canadian Council of Muslim Women, I want to thank Sarah Shaw and our panelists, Arfa Dar, Arij Elmi, Muna Saleh, Yusra Qadir, and Natasha Akhtar. And many thanks to our participants who made time in their weekend to be with all of us. Thank you for sharing your knowledge, experiences, and unique take on Muslim women in Canada of varied backgrounds and diverse intersectionalities. We don't often make time to hear about the daily experiences of our community. We must always remember and be empathetic and truly listen to each other. It is humbling to learn about the very real problems that so many of our sisters face each day. Thank you, dear Sarah, for bringing Canadian Muslim women's lives into focus. Inshallah, as you said, this is just the beginning of these discussions and further research will be done. I hope that we will build bridges and open doors for our sisters and their families to live better lives in Canada. I also want to bring attention to next week's events around International Women's Day. I want you to visit our website, www.ccmw.com, to join our virtual gatherings. Nuzhat Jaffrey, our executive director, will be speaking at an event on March the 8th. Also, Professor Naveen Redha will be speaking on Thursday, March 10th at 7:30 as part of CCMW's Muslim Women's Scholars Series. She'll be presenting an Islamic feminist, spiritually integrative reading of Surah An-Nisa, verse 34. And don't forget to register for the events next week and keep in touch with us. I want to close with this dua or prayer for parents in Islam. Bismillah ar-Rahman ar-Rahim. Rabbana ighfir li wa li walidayya wa lil mu'minina yawma yaqumul hisab. Ya Allah, forgive me and my parents and the believers on the day that the account is established. Ameen. To paraphrase Sarah Shaw, if we move through this world in a mothering way, this world will be a much better place. God willing, we'll be able to join together again, virtually or in person. And until then, I pray we stay safe and healthy. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam. Thank you, everyone. That was such an amazing panel. All of you are have such profound experiences to share, and really relevant thoughts. So we look forward to the next time we're together, inshallah.